Hi guys, it's Chewy here again. So today we're going to be talking about Staphylococcus epidermidis, or just Staph epi. Alright, let's start with a couple of features. First of all, it's a cocci, which refers to its shape, so it's sort of circular. Right? You see this in clusters, right? So just like Staph aureus, think bunch of grapes with this. It's also gram-positive. And this means that you have that thick peptidoglycan layer that can absorb the staining. So it takes on a sort of purple bluish hue as opposed to the pinkish hue that gram negatives take on. So there we go. It's also coagulase negative. Coagulase negative. Now this means that it does not turn fibrinogen to fibrin, which is in contrast to Staph aureus. So fibrinogen to fibrin. So it doesn't do this. Alright. Next up, it's catalase positive. Catalase positive. Now that means that it is capable of carrying out the reaction that turns hydrogen peroxide to water and molecular oxygen. Okay, and just to be clear how this happens, so you can just add peroxide to your slide right there. All right, can then stick on the bacteria there and just wait for bubbles. All right, and that will mean oxygen is being produced. Okay, now Staph epi is also novobiacin sensitive. So novobiacin sensitive. Now this is in contrast to Staph saprophyticus, which is novobiacin resistant. So if you plate this both in a agar that contains novobiacin, only Staph saprophyticus will grow on it. Okay. Okay. Next up, location. Location. You can find Staph epi on the skin, naturally occurring on the skin. Now, where this is important is that when you take blood cultures, this can actually contaminate blood cultures. All right, so it contaminates blood cultures. All right, and the easy way to deal with this is you can draw blood from two different places and plate them both. Right, so you culture them both. If you find Staph epi in both of them, then you do have Staph epi in the blood. But if you just find one of them, then that just means that the other one is contaminated. All right. Next up, gut pathogenesis. Now, Staph epi has a polysaccharide capsule. Polysaccharide capsule. Right, and this helps in adherence. Okay. Next up, you have biofilms. All right, and this is just a matrix of polysaccharide that helps protect it. All right, so polysaccharide matrix. All right, so essentially, Staph epi just creates this, right, around it, sort of a mesh work, right? and this will protect it from antibiotics, right? So antibiotics can get in. All right. Okay. So next up, you've got the diseases you can get from this. So diseases. First off, these biofilms can actually just get onto certain things such as prosthetic joints, right? So prosthetic joints. Like you have when you get like hip replacement, right? And this can lead to infection. You can get onto prosthetic heart valves. Okay. Indwelling catheters, right? And it can also lead to endocarditis in IV drug users, right? So you can end up with endocarditis, endocarditis, all right? And this is pretty simple. Now, next up with the treatment. So for treatment, you just use vancomycin, all right? So a lot of these are methicillin resistant, so just go ahead and give them vancomycin. All right. So next up, let's actually talk about Staph saprophyticus. So Staph saprophyticus. All right. So just as Staph epi, it is also a cocci that you find in clusters. It is gram positive. It's coagulase negative. It's catalase positive. All right. And it is novobiocin resistant. All right. Now, Staph saprophyticus is the second most common cause of UTIs in females, right? So it's second most common cause of UTIs, right? Second only to E. coli, of course. All right. So for the treatment of this, you can give a few drugs. So treatment. First off, you can give Bactrim. Right. So this would be your sulfamethoxazole, trimethoprim, right? So sulfamethoxazole, trimethoprim, right? You can give fluoroquinolones. Finally, nitrofurantoin. Okay. So that's it, folks. See you in the next one.